You are tuned into the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, M.D., M.B.A. The purpose of this show is to help mitigate health disparities, improving literacy related to health, economics, and education. For all your professional development, professional management, and educational support services needs, contact Test Taking Solution, where we're igniting success. Located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Literacy is knowledge and knowledge is power. Thank you for joining the Literacy Hour. All right, good morning, good cold morning, everyone, and welcome to another episode of the Literacy Hour. Today is December the 9th, 2025, and I just want to say good morning to Brother Sherry Jones, who's been holding it down in the studio at WMPR 90.1 FM. My heart and mind have been on the Armstrong family for quite some time, but even more so this morning. I want you to stay tuned to WMPR 90.1 FM for more details about funeral arrangements as they become available for Larry Armstrong Jr. In the meantime, please keep Brother DJ Larry Armstrong and his family lifted up in prayer. Oh, yes, I sure do appreciate that. Thank you so much. You all are on the job early this morning, texting and chatting, and I appreciate it. Keep doing what you do. I'm your host, Dr. Liddell, and this is a Literacy Hour. I'd love to hear from you, so feel free to call 601-714-8378. If you're shy and you just want to message me while I'm on the air, go ahead and text it to me. If I receive it, you know that I'll acknowledge it publicly on air, as I usually do, without calling your name. Now, if you want to share your name, you go ahead and call in 601-714-8378. Let's make sure they have that call-in number put up there. Thank you so much. All right, well, let's just get into it. Okay, we already have a caller. Let's see what's going on. All right. Well, good morning. You're on the air. What's your question or comment this morning?
Morning.
Yes, good morning. Go ahead.
I don't have a question or comment. My name is Derek. I'm driving the truck this morning. Yeah, my name is Derek. I'm driving the truck.
Go ahead and just turn your radio.
And I live in Tuscaloosa.
Okay.
And I just want to give glory to God. Yeah. I just want to give glory to God. God is so awesome. Life brings about things that we can't control, and He's so awesome. When man looks for bad, God turns to good. I had a situation of court, and never seen the judge, never seen the attorney. The doors were wide open. God released me, and I know He's an awesome God, and I know He was there for me. And I just want to let anybody that has a situation to know that God cares. I was listening to you. We were just playing the song by the Ken Spiritual. I'm in His care. We're all in His care because He loves us. He's our Father. And I just want to say thank you guys and Merry Christmas to all.
Oh, same to you, dear brother. Thank you so much for calling in this morning. Listen, you be careful out there on the road and just really appreciate that encouragement. I'm so glad you're listening to the Literacy Hour this morning. This is Second Tuesday, is when we focus on health literacy. So healthcare is a huge topic, a huge career field as well. And so we have a lot of things we want to cover this morning. Recalls. I normally start our show off with some items or medications or equipment and tools that have been recalled. I think it's very important that you know the FDA has warned of hundreds of serious injuries linked to the Abbott diabetes glucose monitor. I want you to be careful with the Abbott diabetes glucose monitors. Been presenting some errors here recently. Certain glucose monitors from Abbott Diabetes Care are providing users with incorrect glucose readings, an error that has been linked with the death of at least 7 people and more than 700 serious injuries worldwide. So I thank the FDA for putting out that warning so we can be aware. I know you're wondering exactly which glucose monitors. Well, I'm glad you asked. Listen, Abbott has warned itself that about 3 million Freestyle Libre 3 and Freestyle Libre 3 Plus sensors are affected. That's the Freestyle Libre 3 and the Freestyle Libre 3 Plus. Be careful with those readings. You might want to use another tool to actually measure your glucose reading just to make sure that your reading is not in error. Patients can visit freestylecheck.com to see if their sensors are affected and to get a replacement for free. Okay. The agency considers the alert to be a potentially high risk issue, and I would say so because it's already been linked to 7 people's death and more than 700 serious injuries worldwide. Continue to follow the FDA about this issue. They keep their websites updated as more information becomes available. But you can also stay locked to the Literacy Hour every Tuesday morning starting at 7 a.m. And as I learn additional information, I'm certainly going to share it with you. We sincerely thank our underwriters, Copiah County Ministerial Alliance out of Hazelhurst, Mississippi, Dixon's Body Shop out of Hazelhurst, Mississippi, and Good Eating out of Byram, Mississippi. Boy, I would love to see a Jackson, Mississippi firm become an underwriter of this show. Let's continue to support these organizations and businesses because let me tell you what now, I wouldn't be up here every Tuesday morning with you, but for the generosity of these underwriters. No, they don't pay me. I don't want y'all to get it twisted. I don't make a dime. I don't get anything. I love making sure that we present facts to you every Tuesday morning related to various aspects of literacy, enhancing our literacy. That's the mission of our foundation, Test Taking Solution Foundation. We want to enhance literacy. We want to help mitigate health disparities by doing so. You see, when we learn better, we have an opportunity now to what? Do better. I didn't say when we learn better, we do better because some of us just don't, but we have an opportunity to. So please give the radio stations a call if you'd like to become an underwriter of the show. We do very special things for underwriters, and you'll find out once you become one. All right. Let me get a few announcements out of the way. They're very important, so I certainly don't want to put them to the back. I want them up front and central. I want you to save the date. The 15th annual Doing Business with the City is going to take place this Thursday, December 11th, at the Jackson Convention Complex. Yes, City of Jackson is encouraging everyone to join them for this special event, Doing Business with the City. It's a great chance to learn about contracting opportunities with the City of Jackson, our capital city. Yes, the name of the event is Doing Business with the City. The cost is free. Again, that date is December 11th, 2025. It's going to start at 6 o'clock and it's be located at the Jackson Convention Complex. So if you have some skill sets, you have small businesses that provide products and services that you think may be of use by the city of Jackson, get there. Find out more information about contracting opportunities and let them see your face so they'll be able to put a name with a face. Network. Go on out. 6 o'clock this upcoming Thursday. Few other announcements. You know, I love our school districts. I mean, they are educating our children, and we want to make sure that all of us continue to support the school districts. And so, as they share information, we're going to share it with you. Jackson Public School Districts today is going to have the JPS Opportunity Culture Virtual Information Session at 3:30. That'll last until about 4:30. On Thursday, December 11th, they will have the Christmas Around the World Night at the Museum. That's the Mississippi Children's Museum from 5:30 until 7:30. The JPS Hines Pre-K Collaborative is bringing the cultures from around the world to Jackson with Christmas Around the World Night at the Museum. Boy, woo, that sounds like an exciting time. From 5:30 to 7:30 p.m., pre-K scholars and their families be able to celebrate the season at this free event through music, crafts, storytelling, and treats. Yeah, before I saw pre-K, I was getting ready to load up our TTS scholars and get them over there, but they happen to be second grade through 12th grade. So we'll sit this one out. But Christmas Around the World Night at the Museum. If you have any pre-K scholar, get him or her over there if you can. 5:30 to 7:30 at the Mississippi Children's Museum. That's being hosted by the Jackson Public School District. Thank you, JPS. Hines County School District. Well, they have a special call board meeting coming up tomorrow, 3 o'clock to 5 o'clock. It's going to be at the Hines County School District Annex Building. You know, the one right off of Highway 18 in Raymond. And then the next day on Thursday, a lot of things going on Thursday, huh? School board meeting will take place from 5 o'clock to 7 o'clock at the Career and Technical Center Public Law and Safety Classroom. I like to attend those board meetings, man, but I'm going to have to find that Career and Technical Center Public Law and Safety Classroom. It's never been held there from what I can recall, but maybe I've missed one or two, and maybe they have held them there. I'm not sure, but we're going to find out where it's located. The address is 14020 Highway 18 West, and that too is in Raymond, Mississippi. Thank you, Hines County School District. Hattiesburg School District, December the 10th, Theater and Dance Winter Concert, starting at 6 o'clock at the NR Burger Transplorium. And then on December 11th, that's on Thursday, they're having the NR Burger Spelling Bee starting at 8:30, still at the NR Burger Transplorium. And later on, starting at 9 a.m., they'll have the Woodley's Winter Concert. Oh, I used to love those when I were in school. I was a drum major at Noxubee County, and we would play wonderful Christmas music during those winter concerts, and just had a great time. And so the Woodley's Winter Concert start at 9 a.m. on December the 11th. It's going to be inside the auditorium. Then on Friday, the 12th, they have a series of events going on there in the Hattiesburg School District. Got strings performance at Turtle Creek starting at 9 a.m. It's going to be Turtle Creek Mall. And December 12th, again on Friday, they have a lunch and learn a palooza starting at 10:30 a.m. That's going to be at the Times Track. And then they're going to have the Beauty and Bow pageant at 6 o'clock that evening in the auditorium. And then a winter dance formal at 7 p.m. That's when it starts. Supposed to shut down around 9:30 p.m., but we know how those dance formals sometimes go. NR Burger Transplorium is where that will take place. Lots of great events that are helping to expose to youth to life, to this world, to one another, helping them to forge friendships, lifelong friendships. I still remember and have close relations with a few of my high school classmates. And here we are, decades on the other side of high school. And so it's so important that we support our school districts and that we help to get our children out to some of these events that are being hosted by their respective school districts. Please be advised that the December drive-through food pantry at the GV Sonny Montgomery VA Medical Center is going to take place on a different date than usual, and that's due to their holiday schedule. So this upcoming Saturday, December 13th, from 9 a.m. until noon. Just go to the GV Sonny Montgomery VA Medical Center front entrance. It's a special holiday edition of their monthly food pantry. They continue to provide pre packed bags of nutritious groceries. It has fresh produce, canned goods, pantry staples. Listen, we have so many wonderful resources throughout the metro city and surrounding areas, but sometimes we just don't know about them, or we don't learn about them until what? After the resource has had some sort of great activity or initiative. Well, we seek to change that with the Literacy Hour. We want to make sure that you know about things well in advance. And also, we want to encourage our hospitals, our school districts, our small businesses, our large businesses to get the information out as soon as possible to the public so that we can get our hands on it and begin to share. Thank you. They've been doing a fairly great job of that. Sometimes, like with the past election cycle, we didn't hear about debates and things like that until the day of and things like that. My goodness. Organization. We get to see how um, individuals will run their show by the way you campaign and the way you show up and do the things that we expect you to do and that you say you're going to do. Now it's accountability time. We're going to be holding folks accountable, not just me in my personal capacity, but I believe all of us are going to do it this go round. Our vote matters. And we want our elected officials to know that they matter. Don't tell us that you're going to do something and you don't do it. At least let us see you trying to get it done. That's just the bottom line on it. If not, if you somehow come up with amnesia and you forget what you said you're going to do and what you said you're going to try to get done, then I promise you we won't have amnesia when it's time to vote again. That's just the way it goes. That's not an empty threat. That's what you call a fact. And that's what we share on the Literacy Hour. Facts. Okay. So, our veterans, I'm so grateful to God and to the VA Medical Center for helping to take care of our veteran families. Please get on by there December 13th. That's Saturday from 9 a.m. to noon and get you some fresh produce, some canned goods. You may not need them right now, but hey, those canned goods will last, okay? We want those non perishable food items for times when you might need them most. So get on by there. The drive through format allows you to remain in your vehicle. You don't even have to get out. Volunteers will load the groceries for you. That ensures a safe, efficient, and respectful experience. Boy, I love it when people consider other folks' feelings and are respectful towards others, and especially during this time of the year. It's a lot of events going on. It's the holiday season, and just be respectful. You know, some of us don't move as fast as we used to, and so it takes us a little longer to get dressed for some events, etc. And I know some of you might be saying, "Well, get up earlier." Well, some of our elderly community members perhaps cannot. So I'm very happy to see that the VA realizes that and says, hey, we're going to bring the food out to your vehicle. You just pull on around to the front entrance. Remember now, supplies are limited, though. There's no endless supply. The supplies are limited and they're distributed on a first come, first serve basis. Now, if you have any more questions, because I don't have all of the details, I want you to contact the VA Medical Center, the Center for Development and Civic Engagement. Their telephone number is 601 364 1391. It's Health Literacy Tuesday here on the Literacy Hour. I want you to be reminded that the information shared during the Literacy Hour, either by the host or guest, is for educational purposes, doesn't constitute medical, legal, financial, or tax advice. For specific advice applicable to your situation, contact a licensed certified professional, preferably one with whom you have a relationship. And remember, relationships matter. Thank you for joining me this morning. I'm Dr. Liddell. The phone line is open and I welcome your questions and comments 601 714 8378. You can also visit our website. It's www.ttsfoundation.org. If you go there right now and click on the Literacy Hour page, you'll find the link to the live stream. Just scroll down until you see the Literacy Hour YouTube channel. It's a link. Just click it and you'll be able to go back and listen to any part of this show or that of any prior episodes that you like. But don't just click it, subscribe to it. And that way you'll be notified whenever we're on air. Today, on this second Tuesday, we focus on health literacy. And what exactly is that? Well, is the degree to which you and I and all individuals have an ability to find information, okay? Understand that information and use that information. So we're not completely health illiterate until we're able to do all three. We can find the information we need, we can understand what we have just found, and we can use it. And so I want us to become more health illiterate because that way we can make better informed health related decisions for ourselves and for the ones whom we love. Caller, you're on the air. What's your question, comment, or maybe you just want to educate us about something this morning? Go ahead.
Yes, I've been listening to you all the morning. I was driving, I was writing fast. I had already called in earlier about I was trying to get the other style on there. Now you was giving that site where you can listen to which one I want to. I missed that. You give me that right quick.
Yes, ma'am. Our website is TTS.
YouTube.
Yes, ma'am. It's that if you go, all right. So it's TTS. That's Tango, Tango.
Wait. Something wrong. Oh, Lord. Okay, one more time. I'm sorry.
That's okay. Thank you for apologizing, but you didn't have to. I understand. T as in, yes, ma'am. T as in Tom. T as in T as in Tom again. S as in salute. So it's TTS. Foundation. FOUNDATION.org. TTSfoundation.org. And you're going to see some tabs across the top. I want you to click on the one that says Literacy Hour. Yeah, when you get an opportunity, go there, scroll down, and you're going to see the link to the YouTube channel.
Okay, thank you.
You are so welcome. Thank you for listening to the Literacy Hour.
Thank you.
Oh, that was so sweet of her to call in. And I love it. You know, when we have a question, ask it. There is no dumb question. We tell our scholars all the time, listen, speak up. Your teachers are there to help you at school. They want to help you, but they don't know you need help if you don't speak up. You got to ask questions as they come about. That's, hey, in relationships, out of relationships, don't be afraid to ask questions. In relationships, don't be afraid to ask a question of your significant other or spouse. It's okay. And if it's not okay, then let me go ahead and tell you, you're in the wrong relationship. All right, that's for another Tuesday. Join me back on fourth Tuesdays when we talk about mental health and wellness. And every now and then, relationship situations come up or you call in about them. So let me just leave that for fourth Tuesday. And who knows, maybe there'll come a time when we discuss just relationships, right? What about Relationship Tuesday? Yeah, relationships matter. Anyway, that website again is www.ttsfoundation.org. Thank you so much, team, for putting that up on the screen. ttsfoundation.org. For those of you who are live streaming, you'll be able to see that website there on the screen. Thank you so much. Otherwise, when you get there, just go to the Literacy Hour page and you'll find the link to the live stream there. But health literacy, I want you all to be able to not only find the information you're looking for, but to understand it. And sometimes I know the health lingo gets kind of funny and sometimes difficult to understand. Well, that's why we're here. You can ask your healthcare provider, your own personal healthcare provider at your medical home, what certain things mean. They have great nurses, I'm sure. So you can also call back to your clinics, hospitals, ERs, etc., and speak to someone about information you might have received from them. But more importantly, I want you to be able to use that information correctly, right? To help inform your decisions and your actions. All right. I want to talk a little bit this morning about preventing the flu. Uh, want to make sure you're protecting yourself and others from the flu by practicing some good health habits and getting your annual vaccination. Um, I do know that several of you have asked me how I feel about the flu vaccine, and I've told you how I feel about it. Um, it works. Flu viruses circulate all year. However, flu activity starts to increase in the fall and continues through the spring. That's our typical flu season. And during most flu seasons now, the peak flu activity happens between this month, the month of December, and February. So I'm talking December, January, February. Flu activity starts to really rev up. Although most people with influenza, same thing as flu. So flu is the short way of saying influenza. So, although most people who have or acquire the flu will recover without causing any additional medical issues, influenza can, and it has, led to some very serious illnesses and death, particularly among older adults, very young children, individuals who are pregnant, and those with certain chronic medical conditions. So, we are uh, encouraged to get a flu vaccine every year. Yes, I've met patients who've said to me, Dr. Liddell, listen, when I first got that vaccine a long time ago, it made me sick and I've never gotten another one. I understand that. And it is what it is. Now, but I do want you to know that the flu vaccine changes every year. Why? Because the flu virus changes. It mutates, it changes, just like that COVID 19 disease, the SARS CoV 2 virus. Don't you worry about that. When I don't want you to get confused. We want to stay on the flu virus right now. And yes, it changes from year to year. So the vaccine has to be updated. And the best way to prevent influenza is to get that vaccine every year, if you can tolerate it, of course. The influenza virus is constantly changing. And each year, scientists they work together to identify which strain is most prevalent, the one they believe will cause the most illness, and then a new vaccine is made based on those scientists' recommendations. So maybe you have youth in your home who might want to become a scientist in this regard and help to develop the flu vaccine. We expose our youth, our TTS scholars during the after school program and the summer academic enrichment program to all sorts of career fields. And so scientists are very important because they help to develop the various medications. So, I really want you to continue to encourage your youth that they can be with whatever they put their minds to in life. And so I'm thankful to these scientists who work every year to identify that virus strain. It's recommended that everyone over the age of 6 months receive an annual influenza vaccine. Um, I'm sending a note. It looks like I'm getting some messages here, and that's fine. Thank you so much. I appreciate that. We'll answer that question in just a moment. So, no problem at all. Um, I'm glad that you're listening to the Literacy Hour. Thank you so much. So, again, everybody, we want you to know that children over the age of 6 months, it's recommended that they get that annual influenza vaccine. Children between 6 months and 8 years of age, They may need 2 doses of the flu vaccine to be fully protected from the flu. But again, I want you to discuss this with your child's healthcare provider or pediatrician. Okay. This is information that you can take to your medical home and talk to them about it. And based on your specific medical history, I fully expect your doctor to do the right thing. We've all been trained, medical school, residency. They know what to do, and they know the pros and cons of you getting the flu vaccine based on your specific medical history. So no, it's not a one size fits all. It's not a everybody go out and get the flu vaccine. Yeah, that's the recommendation, but you still need that advice from your healthcare professional. And I don't like saying that. I'm a physician. I like saying physician and doctor and calling your title, whatever it might be. It's a lot of folks in the healthcare profession doing a lot of things, but physicians went to college, medical school, residency, and in some cases, fellowship to learn the nuances of medicine and of the human body and how things affect other things. Okay, we know the why to a lot of to all health conditions, and not just the how you do this, how you do that, but the why behind it, the reason that we provide this medication and that tool and that equipment. There's a why behind all of that. And the only thing constant is change. Healthcare and medicine, they change every day. And especially with the advent of artificial intelligence, lots of things are changing rapidly in the healthcare arena. You can learn more about some of these AI advances when you join me on the Literacy Hour Fifth Tuesdays. We actually have a Fifth Tuesday in December where we discuss all things tech. So, the flu vaccine is recommended for everyone over the age of 6 months. And for children between 6 months and 8 years of age, don't be surprised if your physician says that you need 2 doses of the flu vaccine. There's a reason he or she will be saying that. And I fully expect him or her to tell you why they are making that recommendation. Doctor means to teach. And it's a long story about how I learned that, but maybe one day I'll get a chance to share it. We all have a story, right? Every single human being. And if you don't, then you're not living. We all have a story. And I love listening. I love listening to patient stories. I love listening to my friends and family stories because, well, even stories matter because they help make you who you are, all the experiences that you have. Children younger than 6 months of age are at higher risk of serious flu complications, but they're too young to get a flu vaccine. Yeah, if they're less than 6 months of age. Because of this, it's important that you safeguard them from the flu. Please, if you live with or care for an infant younger than 6 months of age, you and others in your family should get vaccinated to help protect that baby from the flu. Don't forget now, we're trying to help as many babies as possible to get to their 12th birthday. We got high infant mortality rate here in our state. It's been creeping up over the last few years, and we're trying to stop it in its tracks. We don't want our babies dying. We've talked extensively about that in recent episodes, and especially after we've attended the public health committee meetings, those held by the Black Caucus, Mississippi Legislative Black Caucus, as well as the Senate Public Health Committee. They've been talking some wonderful information about maternal health in general, and not just about the infants. But of course, we can't have the infants without the moms. So the overarching topic to focus on is maternal health. And then once the baby gets here, certainly infant care. So we've been talking a lot about that, and we'll continue to do so in the upcoming months. The best time to get the flu vaccine is before flu starts circulating in the community. So the best time to really get that vaccine is September or October. However, later vaccination can still be beneficial. Want you to know You can still get the vaccine. It's okay. Influenza or flu is highly contagious. It's a respiratory illness and it's caused by influenza viruses. One way to prevent it is by getting your flu shot. I want to stress the importance of the flu shot and that you know who is recommended for. Everyone 6 months and older. All right. How does that flu shot work, Dr. Liddell? Okay, I said I'll get to some of your questions. Let me answer this one. I don't want to be too technical. Let me just put it this way. Flu shots, they help your body to produce some antibodies. Antibodies are these substances, let's put it this way, in your body that fight infections. Antibodies, like antibiotics. Well, yeah, we give you antibiotics because they fight against bacteria. Antibiotics don't do anything against viruses. We need antivirals to fight against viruses. Antivirals and antibiotics are two different types of medications. I want to be very clear about it. And they are for treatment. Vaccinations are for prevention. Let me stress that again. Vaccinations, you're trying to prevent something. The antibiotics and antivirals, you're trying to treat something. So you don't go to the doctor saying, I need an antibiotic, and you got the flu. The flu is caused by a virus. Antibiotics help to treat infections caused by bacteria. Two different organisms, a virus and a bacteria. Okay. The number of antibodies produced by your immune system is the greatest 1 to 2 months after vaccination. So, what does that mean? Time you get the shot, your antibodies don't just shoot up. At least we haven't seen that in the research. I'm not going to say it's not possible because, again, everybody is different. Our DNA, our genetic makeup is different. But generally, it takes about 2 weeks for the body to develop immunity to influenza. And just a few important other facts that you need to know about that flu shot. It's safe. It provides protection against severe flu illness, and it does prevent hospitalization. The flu shot is covered by most insurance plans, including Medicare, Medicaid, private health insurance. I know it's been ticking up. The cost of it has gone up. Mine too. And um, it's locking some people out of being able to afford health insurance. It's sad. It's a very sad state of affairs in the richest country in the world. And I feel mighty bad about it, but it's nothing I can do about it. But it's something we can do about it. We can vote and elect folks into these offices that have our best interests at heart. So listen to these folks' platforms when they're talking about health care and insurance. Don't forget now, that was the reason we had the recent federal government shutdown. It was all about healthcare insurance, health insurance. And one group was saying, listen, those costs are going to go up and we don't want that. Another group was saying, well, we can't avoid it. And things need to stay the way they are, and the subsidies are set to expire in December, and we can talk about it later. Let's get the government back open. Well, the government is back open now. My health insurance still went up. Did yours go up? Is it going up? Some other things went up too. I got a notice about the garbage collection that went up. My accounting system went up. I own a small business, and um, the electricity that went up. Um, no, I didn't use any more than I normally use. Um, the food that's been going up. Um, I can't sit here and tell you anything's been going down. Thank God the gas prices are staying where they are, but other things are going up except our salaries, except the money that we make. And some of us hate to raise prices and then push that on over to the consumer to help cover some of these elevating prices and increasing costs. And so some small businesses, instead of doing that, are just going out of business. They're closing their doors. Well, I pray every day and I ask God to protect us and to keep us um, open because I am so dedicated to making sure that our services are available to the community. But it is tough, you all. You cannot get the flu from the flu shot. Thank you for that question. I appreciate it. Can let me see what this says. My mom took the flu shot and she got the flu a day or two afterwards. Don't forget what I said. Now that flu shot does not activate immediately. The purpose of the flu vaccination is to rev up your immune system, get those antibodies produced so that they can fight that virus when they see that virus strain. That's what it's for. It kind of shows your body the virus strain, a very weak, inactivated form of the virus. And then your body, after having seen the virus, begins to produce antibodies against it. That's that's how it works. So you can't get the flu from the flu shot because it's made from either inactivated, killed viruses or parts of the virus. You need that whole live virus in order to get the whole live influenza, right? People with a history of an egg allergy, yes, you can receive a flu shot. So these are all great questions. Um, Flu vaccines, they're currently trivalent vaccines. This means that they provide protection against the three most common flu virus strains. Remember, I told you now the scientists, they're they're at work all year, just like the rest of us are at work doing what we do with the scientists. They're researching and checking on this and monitoring the flu virus strains throughout the year, and they predict which are going to be the three most commonly circulating ones. Usually two influenza A strains and one influenza B strain. But don't worry about that. Just know that there is more than one flu virus strain. Okay. And the vaccine is usually based on the three most common ones. That's why we call them trivalent vaccines. I'm so glad you tuned into the Literacy Hour on Health Literacy Day. You've been asking some very good questions. Again, experts say people should get vaccinated in good enough time for the medicine to take effect and to prevent catching illnesses like the flu. And same with COVID-19. So we usually start monitoring for that flu activity around late September, early October, but it takes about how long? Yep, 2 weeks for your body to start ramping up antibodies to the flu. So you want to have that response ready before we start to see the high transmission of disease in our community. Let me take this last question. Let's see here. Dr. Liddell, what do you think about the safety of vaccines given your medical school and residency training? Okay. I think they're safe. As I've said, I think the vaccine is safe. The general consensus, too, is that vaccines are safe. But just like with any other treatment, there are some side effects for some individuals. And I want to be crystally clear that vaccines are not treating anything. They're helping to prevent. So there is a difference between prevention and actually treating or managing a condition. And vaccines are safe to help with preventing certain conditions. Yet the good that vaccines do certainly outweigh the risk. Let's put it that way, because there's a risk for everything. And that's why I stress having a medical home. If you don't have a medical home, someplace where you can go to talk to a physician or other healthcare provider, mid-level providers, etc., then please try to get one. Vaccines are safe. Face masks are still a good defense, and so is hand washing. So I want you to really pay attention to your hand washing this season as well. So a few other things that's going on with the flu, RSV, COVID. The U.S. schools, our schools here in the country, they're preparing for a stronger flu variant, because that's what the scientists have already put out. They've already, schools are seeing increase in absences and sick children as the flu vaccine for the 2025-2026 season could be less effective against H3N2. That's one of those strains, which has already caused spikes in hospitalizations in countries, including Canada and the UK. That's the one that's circulating over there. The most, H3N2. Last flu season had some of the highest hospitalization rates in years. More than 280 children died. I told you. I want you to be aware the flu is nothing to play with. And for those of you who've ever had it, you know that little microscopic, cannot see with your naked eye virus can put you on your back. Health experts continue to stress the vaccine is still one of the best tools for avoiding, preventing bad flu season, and that children should stay home when they're sick. Schools are struggling with vaccine hesitancy, though, and increased chronic absenteeism rates. Send your children to school if they're healthy and can go. No state that I know of currently requires the flu vaccine for kids to go to school, and last year, flu vaccinations among students were less than 50%. We're able to track and trend all of this because, well, and just like anything else, there are codes on these vaccines. Yeah, there's certain tracking numbers and codes. So we know who has gotten a flu vaccine, and all that data gets fed back to our public health authorities and the CDC, the Centers for Disease Control and Prevention. And that's how we're able to provide accurate information from year to year. And the information that we have received is that the flu vaccinations among students were less than half of the students got vaccinated last year. And we saw 280 children die. We didn't see them die, but that was the statistic that has been reported. The health department has begun hosting a series of podcasts called Health Talk Mississippi. And I like to think that our literacy hour inspired their efforts, because we've been doing this since November 2022, and the podcast just started. So it's called Health Talk Mississippi, and I'm glad about it. We need to hear from our health authorities, those running and working at the health department. They have the data. They're able to monitor and track data about all health conditions that Mississippians face. Yes, they have up-to-date information as it is made available to them, and is made available to them, I tell you, before it's made available to us, the public. And they are the ones who feed it to the CDC. The CDC doesn't just magically, gets Mississippi information. No, our state Department of Health. That's why I hold them in such high esteem, because that health department is extremely important in terms of helping us all to stay healthy. And I want Mississippi to be healthy. I want us to be the best. And we can't be the best if we don't have the information, if we don't have the data, if we don't know what's going on and where it's going on, if we are unaware of hot spots. So I am an advocate. I am a proponent of dashboards. Put it out there, make it plain, color them, make them colorful. So we'll see where hot spots are and be able to make more educated, better informed decisions for ourselves and our families. Don't hide the information. Put it out, and put it out timely. We need that. We just believe that enhancing health literacy is a very important component of preventing preventable diseases. How can you prevent something if you don't know about it? So enhancing health literacy is important because it helps us to raise awareness about health conditions and public health matters. So I'm mighty happy about Health Talk Mississippi, the health department's series of podcasts. Mississippi State epidemiologist Dr. Rena Dotson and Deputy State epidemiologist Teresa Kittle, they broke down the influenza, COVID-19, and respiratory syncytial virus, that's RSV. Very recently, they help people to know what they can do to keep themselves and their families healthy. And I will say one thing about RSV. It looks like the flu. It can mimic the flu, but it can also mimic COVID. So it's important to have a medical home so we can find out which virus is actually the culprit because there are different treatments for each. And so we don't throw the kitchen sink at things. We want to have precision when we're treating these various viruses. So go get tested. And some things you can test at home. They're over the counter tests now for various uh, uh, viruses. But just know that our state Department of Health is monitoring all of the virus activity in our state. Health officials, they're also monitoring the incidence of pertussis, that's known as whooping cough. The state has seen a recent resurgence in cases of whooping cough over the last few years, and it's concerning. And there are over 90 cases in the state statewide, according to what they shared on the most recent podcast. Um, but last year, they say we had only 49 cases. So, see, those are red flags for me. When I start seeing things spike like that, we got a problem and we need to get to the bottom of it, find out what is causing this. Well, the viruses, the bacteria, they're contagious. But see, pertussis is a vaccine preventable disease. We don't have to have increases in the cases. We can get vaccinated. I learned something else recently. Azolastine, that's a nasal spray, and there were some studies that came out recently that were published in JAMA Internal Medicine that said that this Zastaline um, nasal spray can prevent COVID-19 infections. And some of you have azolastine. You have that nasal spray. You've been using it for your allergies. It's an over the counter nasal spray. It's been used for years as a safe and effective treatment for seasonal allergies. Well, guess what? A recent study found that it could potentially prevent COVID infections. So don't throw out your azolastine. That's Azalastine. Of course, that's a generic. That's what doctors deal with. I think the trade name is Astra Pro or something like that. But azolastine is that main ingredient, right? It's the generic name of the medicine. That's a nasal spray. A growing number of studies have shown that this antihistamine, because that's what it is now. We were talking about antivirals a moment ago with those vaccines, but azolastine is an antihistamine. Mhm. It's been shown to work as an antiviral against a range of respiratory infections. So I'm excited, including influenza, RSV, and the virus that causes COVID. That's SARS-CoV-2 virus. In the current study, participants were given COVID rapid tests twice a week over the course of about 2 months. Every 2 weeks, they got this COVID test. Those folks who were using azolastine, by the end of the study, the incidence of the COVID infections in the azolastine group was 2.2%, significantly lower than the 6.7% infection rate in the placebo group. We teach our TTS scholars about science and scientific experiments and the scientific method. So, for those of you scholars who are listening to me, you know that the placebo is the control. Those people did not get azolastine nasal spray. And those who got the spray, well, they were less likely to get COVID. Listen, research matters, and that's why I'm so glad you're locked and loaded listening to the Literacy Hour. Caller, you are on the air. What's your question or comment, or maybe you want to teach us something this morning?
Well, I don't know. I don't know if I can or not, Dr. Liddell, but thank you for what you're doing. That's the first thing I'm gonna say, and we're grateful on the issue where our babies dying in the state of Mississippi.
Yes.
That it appears that our elected officials now are beginning to take this issue serious. And it came from the fact that citizens decided that if our elected officials was not going to take it serious, Dr. Liddell, then we would step up and take it serious. That's and right. Begin to do what we believe needed to be done. That's so right. You was correct this morning. The Black Caucus did host a hearing at the Capitol, which was long overdue. The Public Health Committee held a hearing up at the Mississippi State Capitol, very impressive, but I say again, long overdue. Last week, Dr. Daniel Edney was requested to travel to D.C. to testify before a committee. So things are beginning to move, but we cannot take our finger off, nor can we accept losing these many beautiful babies in the state of Mississippi or any state for that is concerned. All
You
right. The next thing, Dr. Liddell, is we're working on a health initiative that we hope to have ready to roll out at the first of the year dealing with obesity. I know you've done a
yes,
lot of work on that,
yes.
but that's something that Dr. Edney say is contributing to the loss of life is when our beautiful women get pregnant that they already obese and the obesity is causing so many different issues.
That's right.
So we're gonna let people make it over the holiday season, Dr. Liddell. All right, but they need to be getting ready. January 1, we're going to be rolling out a new health initiative around obesity in the state of Mississippi. And we believe that if we can get people to just pay attention, learn, change their behaviors and tradition, that we can begin to see some improvement in the health of our people in the state of Mississippi. Nobody is coming and rescue us
That's it.
if we don't do this for ourselves, okay? And again, I say I thank God for the work that you do, staying on the wall to keep our people informed. You've been out here for a number of years. You up in the snow, sleet, and rain to make sure that you're informing our people. And you've been a blessing to this community. I say that. Look, again, thank you for what you do. God bless you.
Wow, thank you, Mr. Jones. And he's right on target. He hit two very important topics that, yes, we've talked about and we're going to continue to talk about. As a matter of fact, the second Tuesday in January, I'm going to dedicate that health literacy hour to talking about obesity. Yeah, we're going to talk about it. We're going to break some things down because, yes, I've mentioned it here before, but maybe some of you weren't listening at that time. And I want you to know that there are a couple of things that have transpired with obesity in every U.S. state. At least 1 in 5 people have obesity. 1 in 5, you all. And Mississippi just happens to be on top of the list. We can't have it. I told you how important the Mississippi State Department of Health is, and Dr. Etney has been on the wall. He can't do it by himself. He needs troops. He needs us. He needs you. He needs me. But at least 1 in 5 people has obesity. Body roundness index. We talked about that right here on your local radio stations. I know you're listening to me all up there in the Delta, Noxubee County, Oktibbeha. I see you. Thank you so much. Hattiesburg. I know you're listening to us all around. So listen, body roundness index is gaining support as the BMI, the body mass index replacement. We'll talk about that. We'll talk about body fat percentage, your waist circumference. And we'll talk about the obesity drugs again. But I want you to know that obesity rates have spiked among Black youth ever since the pandemic. And I'm going to tell you why. Studies are out. People are researching this. I'm going to tell you about the GLP-1 medications again. We'll be talking about that in January. In the few little minutes I have left, I do want to mention the other topic that Mr. Jones spoke about. The MSDH declared a public health emergency on infant mortality back in August. I got the press release August 21st, and we talked about it the next day. Listen, the Mississippi State Department of Health declared that the PHE a public health emergency. And everywhere I've ever been, an emergency means life or death. And we got to stay on the wall. When you have an infant mortality rate that has increased to 9.7 deaths for every 1,000 live births, and in the Black community, it's far higher than that. We're talking 15. Come on now. And so we must stay on the wall. And I'm glad all the hearings have taken place, but they did not take place by themselves. There were some community members like Mr. Jones who helped to spark that. And I'm just listen, we got a whole health department. Now, look, I'm expecting them to stay on the wall. Causes of sudden unexpected infant death, that Mississippi Child Death Review panel that presented during some of those hearings said that 67% had sleep-related factors. 63% of those babies who died were not sleeping in their own space. 47% had unsafe bedding or toys in the sleeping area. Get those toys out of that baby bed. 37% were not sleeping on their back. Put the babies back to sleep. Please put them on their backs to sleep. 30% were co-sleeping with adult caregivers and siblings. 10% had caregivers fall asleep while feeding them. We're going to be talking more about it. Thank you so much for tuning in to the Literacy Hour this morning. Yes, our hour does go pretty fast, doesn't it? But we are grateful to God. I want you to get you a medical home if you don't have one. If you'd like to be a guest on the show anytime, you can call our foundation 601-714-8378. Want you to have a great rest of your day. Thank you. We'll talk to you again next Tuesday if the good Lord says the same. For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, M.B.A. We are located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation here on our podcast live stream and affiliate stations.